Hi everyone, welcome to Medicine Note YouTube channel. In this video, we're going to see about management of the diabetic ketoacidosis. I have already uploaded a video on diabetic ketoacidosis. Please do watch it before watching this. I will provide the link in the first part of the video in the description box. Please do watch it. Now we will see the management. First, the admission of the patient. It starts from the admission of the patient. The diagnosis is confirmed by the examination of the blood glucose and the ketone measurement. We should diagnose the patient whether he is having diabetic ketoacidosis by diagnosing the blood sugar as well as the ketone level of the patient. Initial assessment is assessment of dehydration, hyperosmolarity, serum potassium, acidosis and kidney function test is done. First, we should assess these things, which are dehydration, whether the person is dehydrated, hyperosmolarity, osmolarity should be seen, serum potassium level and acidosis and kidney function test are seen. The fluid loss are measured by subtracting the admission weight. How to find whether the patient is dehydrated? We should first we should weigh the patient when he comes to the clinic or hospital first. We should minus the last known stable weight. By minusing that, we can see whether the fluid loss in the body is seen. The patient should be evaluated for sepsis. The first management, if the patient is hypovolemic or hypertensive, the fluid administration is done and the saline is administered, and if necessary, colloid should be given. First, we should, patient is dehydrated, so the fluid administration should be done. Hypovolemic, so there is fluid loss in the body, so fluid administration done. By using normal saline, we should administer, or sometimes you can use colloid also. Continuous IV fusion of regular insulin 5 to 10 units per hour is given. Due to high amount of blood sugar level in the body, we should provide insulin 5 to 10 units per hour. As well as IV infusion of the potassium is done at 10 to 40 milliosmol per hour during the initiation of insulin therapy. During this starting of this insulin therapy, we should provide the potassium infusion also. Sodium bicarbonate is given in IV to take care of the acidosis. Due to this diabetic ketoacidosis, due to the acidosis, sodium bicarbonate is also given in IV. Management during the hours. Normal saline should be continued at 500 ml an hour. Plasma osmolarity should be greater than 285 osmol per liter during the first 12 hours. Normally, the saline should be continued as well as 500 ml per hour. Plasma osmolarity should be given greater than 285 osmol per liter during the 12 hours. The serum potassium should be maintained at the 45 milliosmol per liter by addition of the potassium of the IV fluid. The serum potassium should be also given, and we should maintain the osmolarity of 45 by addition of the potassium in the IV fluid. This is done in the management of the second hour. In third and fourth hour, we should continue the treatment of the second hour, as well as the cognitive and the neurological symptoms should be observed for the 12 hours. The management of 5 to 8 hours. The phosphate replacement is done at 6 hours if the serum phosphate is less than 2 mg per deciliter. Potassium should be continued at 10 to 40 osmol since the ketoacidosis is cleared. Insulin should be maintained until the ketoacidosis. Insulin should be repeatedly given until the ketoacidosis gets reduced, as well as potassium should be also continued at 10 to 40 milliosmol hours until the ketoacidosis is cleared. The management of this the management during the 18 to 24 hours IV repletion is continued with 0.4% saline or without 2.5% or 5% glucose is needed. At ketoacidosis, the subsided patient should be switched to the subcutaneous insulin and stop the IV or IM insulin. We should not give the insulin in intramuscular or intravenously. We should give the patient after the diabetic ketoacidosis is cured. We should take the patient to go in subcutaneous aspect. This is all the treatment of the diabetic ketoacidosis. If you have any doubt on it, please do comment it. If you want more videos, please do subscribe. For notes, please do follow my Instagram page. I will provide the link in the description box. Thank you.